Hey, Doc.
That must be you.
That's me. How are you? Let me help you out. You got that?
Yeah.
Just put it right in the side here.
Wait, this door?
Yeah.
What's that?
Yeah, beautiful.
All right. Look
Yeah.
at this.
Yeah, not bad, huh?
Now, why down East Main?
Oh, man. Have you been there?
No. Yeah. Where?
Well, I got a house up there, first of all.
Where?
In Lubeck.
Back.
Way up. Down. I mean, as far up as you can go. It overlooks Canada.
Okay. so
Right
I'm
on the
not-
border on the ocean.
Yeah. I've driven up there. Booth Bay Harbor. No. The Bay of Fundy and all that
That's
stuff.
exactly
Yeah.
right. Very high tides there.
Incredible.
Yeah. So let me just have a look at you
my
here.
God.
Make sure you look okay. Hey, you look good.
Oh, jeez.
Thanks for, yeah.
This isn't going to go to the CIA or anything, FBI.
They
Russia.
probably all know about you anyway, right?
Yeah. I don't know. Come on, though.
So I'm going to take you to the airport.
Oh, good. Thank you.
Okay, sure. That was the deal here. Well, look, it was
Is it
very
on?
interesting.
Is it
last
on?
night. Oh yeah, we're always on here.
And you,
We edit.
how'd you know that word?
I've been there. Believe me, I've had to do a bunch
Okay,
of it
so
before.
I just, yeah, it's like this Jerry Seinfeld, doesn't he do this?
You got it.
That
Yeah,
scene
right.
in his
right.
cars, yeah.
Exactly.
All right. Okay, I'm ready. Go ahead.
All right. So you came here last night. You're a
Yep.
psychiatrist.
I'm a
You-
psychiatrist.
Yep.
Yeah.
You came here last night to do a talk.
Yes.
Who invited you, and why did you come
Well,
here?
the organization, and I forgot the name of it, but there is an active organization of which Holly McGowan is the chair of it.
Right.
And they heard about me. I'm an addiction psychiatrist practicing in Boston for a long time. It might have been through Dr. Robert Berlin, who's a psychologist on the island, and also lives in Boston, who's a colleague of mine. So I think they wanted me to come and just help out in this forum that we did last night around the issues of the opioid epidemic that's sweeping the country, sweeping Massachusetts, and the problem on Nantucket. Not clear the extent of it, but other than it's like everywhere else, it's a significant issue that has crept up on us as Americans
Yeah.
in the last
Certainly has.
so many years. Yeah.
So what's the big difference between when I was a kid and drugs and the issue we had with drugs in the 60s and 70s
Yeah.
compared to today?
That's a
How
good-
would you
Yeah.
describe what we have today?
Well, in the thank you in the 60s and 70s, I was actually starting to practice medicine and graduated in 73. I'm a product of the 50s and 60s, and heroin and I was around, but it was I think relegated to my memory jazz musicians, Harlem, Miles Davis, John Coltrane, the people
Yeah.
and it was a drug that provided them with pleasure. There was something, I think, I don't hear this word anymore, called chipping, where people could use heroin and get by. And it was just a pleasurable drug, relegated to certain sectors of the society. So there was that. Now, also there was, when I practiced in Cambridge, Mass, there was a methadone program that started in the 70s, which I was aware of and loosely affiliated with. But it was kind of small stuff. It was, people that were using heroin and needed help through the methadone programs, which are very successful. What happened, I believe, is that in the 80s, it was felt that pain, acute and chronic pain, was undertreated by doctors. And it was actually called the fifth vital sign after temperature and pulse and blood pressure. So there was a big push to treat chronic pain and acute pain. At the same time, drug companies were coming up with these new drugs. The biggest one was oxycodone and OxyContin, a long-acting version. What was not known, and similar to the tobacco companies, the manufacturers of these drugs said there's no addiction related to them. So doctors started to, not only these drugs were very available, doctors started prescribing them like crazy. 60 at a time, refills, the whole bit. So that was one thing, that the drugs were available. And then I think on the other hand, people, I think the youth became more disaffected. Marijuana is much more widespread.
I know, right?
So,
well, that's a good point.
Yeah.
When we think about other cultures in the world and who actually uses drugs, would you say that in the United States we're more of a drug user than Europe? We have more issues than Europe does?
Yes.
Why is that?
Well,
Why do you think that is?
Because we are more of a prescription drug country than anywhere else in the world. We prescribe, doctors, I'm a doctor too, but by the way, as a psychiatrist, I don't prescribe opiates because I have basically no indication for it.
Is that something you just recently decided not to do?
No, I just never have. No, never
really?
have.
Really?
Yeah, because it would be very problematic. The enforcement agencies don't look kindly on psychiatrists prescribing opioid drugs for pain. That's more relegated to primary care physicians, family doctors, surgeons, OBGYN, people that have patients that are in pain or have been operated on and need relief from that, or chronic conditions. So I think we by far are prescribed more opioid drugs in this country than anywhere else in the world.
And what about heroin use? Just straight out heroin use. Is that similar?
Well, that's a good question. I don't know first of all, the heroin use in this country is increasing and expanding because people move from the opiates to the heroin. It's a bigger high. It's cheaper. It's on the street. As the supplies of oxycodone get cut off, as doctors prescribe less and less, we don't know what's going to happen. People might get more to heroin. Now, the problem, I think, with heroin is Afghanistan, where opium is primarily produced, Burma, Myanmar, China, Russia. They have a huge problem in those countries. They don't have access to clean needles, so therefore there's the HIV rate, infection rate, hepatitis C must be very high. We don't hear too much about those countries, though, but I think that in some of the villages of China, way up in the mountains, I think it's rampant. People who have miserable lives.
And it's all because heroin is getting so cheap. That's...
it's cheap because it's plentiful.
Yeah.
The production of opium in Afghanistan is increasing every year. There's more opium produced, what I understand, more opium produced in Afghanistan than the world needs. So there's an excess. It's also now being produced in Mexico by the drug lords because it's a moneymaker, and in Burma. I think those are the three big areas. A lot of the heroin comes from Mexico now, not Afghanistan. It's a powerful drug. I tend to think that very few people can resist it.
Have you ever tried it?
Never.
Even though you deal with these people all the time.
I am not going to try heroin. For one reason, big reason, I might like it.
I mean, did you ever have an issue?
No.
Okay.
No.
Right.
I have not, no.
So how do we, and then I always come back to the kids and keeping people away from it, in the first place. Isn't that the key?
That's a key.
I mean, and why is it that in our lives we feel that, something's missing and we got to try this drug?
It's a multi-factored answer to that. I think one, from my point of view, is the availability of it. It's around. It's in the playground. It's in the schools. Kids know where to get it. Not just heroin, but Percocets, OxyContin, oxycodone, Vicodin. These drugs are everywhere because they're being prescribed, and so they go into the medicine cabinets. The grandparents have this and that. So number one, it's available. Number two, I think it's become peer acceptable to experiment and try these things. Just try it once. Oh, here's a pill. Try it. We're sort of developing a drug culture, I think, amongst the young people. And I think 3, they don't know what they're doing. They don't know. That's part of the education process. They don't know what these drugs can do to them. They don't know about habits, addiction. It's just fun. I think then the disaffected youth, the big issue, I think, for many people that start this stuff is histories of stress, anxiety, depression, trauma. Trauma is a big word. If somebody's been traumatized, something going on in the family, is not working right, they've been alienated, they're going to seek pleasure. And these drugs provide instant pleasure.
And what about marijuana as a gateway? Do you feel that it is?
I think it is. I know that's controversial, but the marijuana of today is not the marijuana of old. Marijuana of today is being scientifically produced with a THC, which is the active ingredient of marijuana, at extraordinarily high levels. Can be up to around 30%. That is a potent drug that we've never experienced before.
But aren't they tweaking it to make it to give you the certain, because it's in many cases it's medically effective?
Well,
right?
I think they're trying to do that. I'm not so sure how effective that is. On the other hand, many patients find significant relief from it. I say patients, that from pain, from anxiety, from depression, chronic disorders, and I don't have any objection to that. My objection.
Would you prescribe it?
I'm not going to. It's not. And
it's more of a doctor would prescribe it.
The word the prescription is not the word. The word is certificate.
Okay.
Doctors in Massachusetts are allowed to issue a certificate, which allows the person, his or her patient, to go to a dispensary, which are just opening up. I think that we only have 2 in Massachusetts, to get marijuana. I'm not going to do that.
Okay.